And I always am somewhat taken aback when someone calls me a distinguished professor, because when you hear that, it usually means the next step is they're going to put you out to pasture. So I'm very pleased to be here, in all honesty, and I hope that what I'm going to tell you today about AIDS-defining and non-AIDS-defining malignancies will be helpful to you, both in terms of your development of this field as an area of research here at Duke, but also, as you'll see, it's become a bigger and bigger part of the global problem of HIV and AIDS. Okay. So I first want to make the point that many of the cancers that we see in association with HIV are related to another co-infection, usually a DNA virus. And so we're all familiar with the fact that Kaposi sarcoma is associated with HHV8, human herpes virus type 8. The non-Hodgkin's lymphoma that we see in AIDS are both Epstein-Barr virus, as well as in some cases HHV8 associated. And cervical cancer, which is another AIDS-defining cancer, is associated with a number of strains of HPV. In addition, a number of the non-AIDS-defining cancers, which are increasing in frequency, are also virally associated. So anal cancer, for example, like cervical cancer, is a squamous cell tumor that's associated with HPV. Hodgkin's disease, at least in the HIV setting, is almost always associated with Epstein-Barr virus. Leiomyosarcoma, which is a rare tumor in pediatrics, we believe may also be EBV associated. And then there are a number of other tumors, such as squamous cell carcinoma of the oral cavity, these so-called head and neck type tumors, which in the setting of AIDS is predominantly HPV related, not in general, but in the AIDS setting it is. Merkel cell cancer, which is a very unusual cutaneous tumor that also occurs with about a 5-fold higher incidence in HIV, was recently also found to be associated with a DNA virus, a so-called Merkel cell virus. And then, of course, many of the hepatomas, as you may all realize, are or can be associated with hepatitis B and C. So these are virally associated cancers to a large degree. Now, the incidence of these cancers has changed with the widespread use of highly active antiretroviral therapy. So Kaposi sarcoma, the CNS lymphomas, has declined dramatically, such that we don't see very much of this anymore in the U.S. Non-Hodgkin's lymphoma, in general, has also declined. Hodgkin's lymphoma, on the other hand, has increased dramatically. And in fact, the incidence of Hodgkin's lymphoma is now about 10-fold higher than what it used to be in the pre-heart era. Similarly, cervical cancer and anal cancer are on the increase. Lung cancers of all histologic type, but predominantly adenocarcinoma, is being seen with increased frequency. But the very common tumors, such as prostate, breast, and colon cancer, really has not been shown to have increased frequency in HIV. And hepatoma, interestingly, is still flat in terms of its incidence, and that's because it takes many years, on average about 25 years or so, from the time of acquisition of those viral infections to development of hepatoma. But we anticipate, and in fact we're beginning to see some series have started to show increases in hepatoma in the setting of HIV. So this is some data from a well-known the so-called Cascade collaboration, which is a collaboration of 22 cohorts that have been followed from the time of seroconversion. What it's showing here is that the incidence of, the mortality from from AIDS has certainly declined substantially with heart. But interestingly, the causes of death have shifted from being predominantly opportunistic infections or other infections to being more related to hepatitis and liver failure, malignancies, and cardiovascular disease. So in the heart era, the disease are shifting.